Good evening and welcome to our telecast of Just the News. I'm Faye D'Souza. Let's get straight to it. The Prime Minister Narendra Modi today said he empathized with people's pain and suffering because of COVID and described the virus as an invisible, quick-changing enemy that's challenging the whole world. He said, and I quote, "Because of this coronavirus, we have lost people close to us. The pain that citizens have suffered and many have experienced, I am feeling equally. As your Pradhan Sevak, I share your every sentiment." So far, he said, around 18 crore vaccine doses have been given. Government hospitals are giving free shots across the country. So please do get your vaccine when it is your turn. As the Prime Minister said this, states like Karnataka, Delhi, and Maharashtra have decided to float global tenders to procure COVID vaccines because of the massive shortage. States like Karnataka and Maharashtra have also suspended vaccine drives for people in the age group of 18 to 44 because of the same shortages. Meanwhile, India reported 4,000 deaths for the third straight day. We have a total of 3,43,000 new cases in the last 24 hours. Kerala, Karnataka, Tamil Nadu, and Uttar Pradesh are now the worst affected. Niti Aayog member V.K. Paul on Thursday refuted allegations that the government was unaware of the intensity of the second wave and said the virus can emerge again, and so national and state level preparations have to be made accordingly. He said, and I quote, "We kept warning again and again from this platform that the second wave will come. The Prime Minister had conveyed to the country about the emerging second wave on the 17th of March without creating panic and had said that we have to fight it. Was this peak expected? Well, no modeling can predict the size of this peak, as unexpected behavior of the virus is well known," end quote. Just to point out to you, on the 17th of March, according to Dr. Paul, when the Prime Minister alerted the country, we were already reporting 28,000 cases across the country at that time. US Chief Medical Officer Dr. Anthony Fauci has said Indian government's decision to increase the gap between the Oxford-AstraZeneca Covishield vaccinations is a reasonable approach. Fauci said the government's move will help ensure more people receive at least one dose of the vaccination. According to ANI, Dr. Fauci has been quoted saying that when you are in a very difficult situation, the way you are in India, you have to try and figure out ways to get as many people vaccinated as quickly as you can. So I do believe that this is a reasonable approach to do. It's unlikely that the long delay will have a negative effect on the efficacy of the vaccine. This comes after the government on Thursday announced that there will be an increase of the gap between the first and second doses of Covishield from 6 to 8 weeks to 12 to 16 weeks. The Kerala High Court asked the central government to place a time frame before it for vaccines to be allotted to the state of Kerala. Now, the bench asked, when are we going to get the vaccine? If you delay the whole thing, new mutations will come up and people will die. We have asked you to put details of the vaccine to the state of Kerala. Where is it? They also asked for a time frame for when the vaccines will be supplied, the manner in which it will be supplied for the immunization of Kerala. They said, we want to get an idea immediately. The centre asked for time to file a statement. Last week, Kerala Chief Minister Pinarayi Vijayan had said the vaccination of those in the age group of 18 to 45 with comorbidities will be given priority. The Delhi High Court has also pulled up the central government, questioning the irritating caller tune that is being used right now to spread awareness on the vaccine drive. The High Court bench of Justices Vipin Sanghi and Rekha Pali said, and I quote, "You are not vaccinating people, but you say that vaccine lagayenge. Kaun lagayega vaccine? Where is the vaccination? What is the point of this irritating message?" End quote. The bench is hearing a clutch of petitions concerning the COVID-19 situation in the national capital. The court has asked the centre to ensure steps regarding the dissemination of information regarding COVID-19. The court said the ICMR has put all the material here. They have dumped it here and categorized it. We're talking about disseminating it among the public. It's not very conducive to do it like this. We need someone to educate people. Make video clips, use graphics, give it to newspapers. You can ask anyone, ask Mr. Bachchan. It should be done soon. There should be some sense of urgency. We are losing time. Please report by Tuesday. Hyderabad-based Dr. Reddy's Laboratories has announced that Russia's Sputnik 5 vaccine will cost 995 rupees and 40 paise per dose in India. This is a two-dose vaccine, which means the complete dosage will cost twice as much. The price includes GST of 5% per dose. The Union Health Ministry has announced that the vaccine will be available in markets across the country from early next week. Niti Aayog's Dr. VK Paul has said the local production of Sputnik 5 will also begin in July. Meanwhile, Niti Aayog member Dr. VK Paul on Thursday announced that Bharat Biotech is ready to share the Covaxin formula with other manufacturers. According to ANI, Dr. Paul had said people are saying Covaxin should be given to other companies for manufacturing. I'm happy to say Covaxin's manufacturing company, Bharat Biotech, has welcomed this when we discussed it with them. For this vaccine, the live virus is inactivated, and this is done in biosafety level 3 labs, which basically means that the work involves using agents that could cause potentially lethal impact on the people handling it if it's not done in the proper environment. So this has to be done in a very specific lab. So VK Paul has said not every company has these labs. We've given an open invitation to companies who want to do this. Companies who want to manufacture Covaxin should do it together, and the government will assist. The Finance Ministry has asked states and union territories to vaccinate banking staff on priority. The Department of Financial Services Secretary Debashish Panda has said all state and union territory governments are requested to instruct local authorities to provide necessary help for vaccination of those delivering banking and financial services. Vaccinating them on priority will mitigate their health exposure to the risk of delivery to public service. It doesn't answer the question of where these vaccinations are going to come from. According to the All India Bank Employee Association, 1.5 lakh bank employees have been affected by COVID so far, and about 1,200 employees have died of COVID. In the wake of an impending cyclonic storm that's likely to hit Kerala in the next couple of days, the Kerala government has asked the central government to rush 300 metric tons of oxygen to the state. In a letter to the Prime Minister, the Kerala Chief Minister has said the Indian Meteorological Department has issued a cyclonic storm warning forecasting heavy rains and winds in parts of the state on the 14th and the 15th of May. The CM noted that there would be disruptions in the electric supply to oxygen generating plants and filling stations, and disruptions in road transport, which could impede timely oxygen supply necessary to save lives. And hence it has asked the central government to rush 300 MT of oxygen to the state of Kerala immediately. Before we go any further, I must issue a trigger warning of the next story to our audience. If you are experiencing anxiety and stress, I would recommend that you don't watch this video any further. Following reports of dead bodies found on the banks of the Ganga and the Yamuna in Bihar and Uttar Pradesh, now half-burnt bodies are being spotted in the Ganga in Uttar Pradesh. According to a report in NDTV, officials say that there is a possibility that these bodies were pulled off the pyres and thrown into the river. They say that there is a possibility that there wasn't enough wood for the funeral pyres, and to dispose of the bodies, the families then threw them in the river. Around 7 corpses were spotted in Ramnagar in Varanasi in the morning, and 3 of them were half burnt. Earlier this week, bodies were found buried in the sand in the Ganga as well. Meanwhile, a PIL has been filed to the Supreme Court seeking a special investigating team inquiry into this incident. According to the petition, 100 bodies were found in the river, 71 in Buxar in Bihar and 30 in Uttar Pradesh, and the cause of death should be investigated. The petition also said that if the bodies were infected with COVID, it might spread in the villages of both the states. In the last 4 days, 75 patients have passed away at the Goa Medical College Hospital, which is the biggest COVID facility in the state of Goa, due to logistic issues in the supply of medical oxygen, according to the Goa government. On Thursday, the Goa High Court bench was told that logistic issues involved the maneuvering of tractors, which were carrying oxygen, and the connecting of cylinders to manifold, which led to a fall in the pressure of supply lines to oxygen to patients. It was pointed out that basically on account of these factors, some casualties may have taken place. The bench slammed the state, saying COVID patients cannot be allowed to die because of logistics. The Goa Chief Minister Pramod Sawant has reiterated one more time that there is no scarcity in oxygen supply in the state. In other news, away from COVID right now, the Central Public Works Department of the Government of India has prohibited photography and video recording of the construction site of the Central Vista project near India Gate. This comes after the project had been severely criticized by national and international media for being considered an essential activity at a time when we have a catastrophic pandemic hitting the country and Delhi is in lockdown. Earlier this week, 12 opposition leaders wrote to Prime Minister Narendra Modi asking him to stop the work on this project immediately and divert the money to COVID relief. In the letter, opposition leaders said stop Central Vista construction and use the allocated money to procure oxygen and vaccines instead. Release all of the money held in unaccounted private trust fund of the PM Cares Fund to buy vaccines, oxygen and medical equipment that is required. Let's take a look now at news coming in from the world of business and economy. The 8th installment for the financial benefit under the Pradhan Mantri Kisan Samman Nidhi or the PM Kisan scheme has been released according to a release from the government. More than 19,000 crore rupees will be transferred to bank accounts of 9.5 crore beneficiary farmer families. This effectively is part of the PM Kisan scheme. Now, this was launched before the 2019 election. It basically promised 6,000 rupees into the accounts of beneficiary farmer families in quarterly installments, which means 2,000 rupees in each installment. One of those installments has now been released. You will likely see this in an announcement in your newspapers tomorrow morning saying that the money has been released. But we must also remember that this is taxpayer money that is now going out. The Prime Minister has announced as part of this, said, as part of this scheme, the government is working towards encouraging farmers to take up alternative forms of farming, such as organic farming. These crops require investment and they're good for health and for soil too. It also sells at a higher amount. Petrol and diesel prices hit an all-time high on Friday, that's today, when rates were increased for the 8th time in the month of May. In Delhi, petrol prices are now 92 rupees and 34 paise, and diesel is at 82 rupees and 95 paise. In Mumbai, we pay 98 rupees and 65 paise per litre on petrol and 90 rupees on diesel. Now, news coming in from around the world. According to latest government figures, 119 people, including 29 children, have been killed in the airstrikes in Gaza over the last 4 days. Reports now of violent confrontation between Israeli and Palestinian citizens in various cities have also begun to surface. Israeli Justice Minister Benny Gantz has called on the chiefs of the social media platforms to remove content from their sites that incites violence and spreads disinformation. As of the 14th of May, Israeli Defense Forces have said that it continued to launch airstrikes on Hamas rocket launch sites. The CDC of America, which is the center of which manages their entire communicable diseases problem, has eased mask wearing guidelines for fully vaccinated people. So basically, the campaign in America, in the US right now, is you either get vaccinated or you wear a mask. So people who have been fully vaccinated have been told they no longer need to wear masks in most indoor places. The agency has recommended people continue though wearing their masks in crowded indoor settings, public transport, hospitals, and homeless shelters. Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing. If you're fully vaccinated, you can start doing the things you had stopped doing because of the pandemic, said the CDC director, Rochelle Walensky. Now, in an emotional address from the White House, US President Biden declared this a major victory against the battle against the virus, which has seen more than 5 lakh Americans die so far. This vaccination drive right now will also help schools reopen faster and offices open as well. 60% of American adults have now had either 1 or 2 doses of the vaccination so far. Also an update now from the world of sports. The All-English Champions League final between Chelsea and Manchester City will now be held in Porto with 12,000 fans. The final will take place on the 29th of May and has been moved from Turkey's Istanbul. This comes after Turkey introduced new travel restrictions, which would have prevented a large gathering of fans. One piece of positive news before we leave you for the day. Reverend Megan Rocha has become the first transgender bishop in the Lutheran Church. Megan Rocha previously served as the church's first open transgender pastor. According to CNN, Megan Rocha said, "It's humbling, it's inspiring, and I'm very aware that this call is bigger than me. It's about serving God, and it's about a place in history that means a lot to a lot of people." Well, that brings us to the end of this night's bulletin. Do stay home and stay safe. And if you have any suggestions for us on how we can improve this broadcast, leave it for us in the comments. It will be our pleasure to hear from you. Thank you for watching.